jump into this assembly where we're talking about neurodiversity, medical concerns with our children, and finding a community of support within sort of those conditions. So before we jump in, just a quick note about sort of who we are at Cooper, who I am, and who our panelists are, although definitely want to have you all introduce yourself in more depth than I'm going to. But so my name is Dr. Erin O'Connor. I'm the Chief of Education here at Cooper. I'm also a professor at New York University, where I lead the early childhood program. And I am thrilled to be a part of the whole Cooper community that we're trying to create here, because the idea is really to take the valid and reliable research and present it to the parenting and educational community in a way that folks can take what is best for them and run with it. So along those lines, we do things like assemblies today, where we have experts and parents come in and talk about their experiences, as well as virtual parenting groups that meet once a month. So I'm just going to go around, the Zoom world, sort of my Zoom, my Zoom world, and briefly say who's joining us today, and then allow you all to introduce yourself in more depth. So we have Chloe Massey, who is one of our facilitators here at Cooper, as well as director of content. And she is going to talk a little bit about her experiences, both as an individual with a learning disability, as well as an educator and researcher, and the mom of two. And then we have Dr. Allie Ticktin here, who is an occupational therapist with a specialty in sensory integration and early childhood development out in one of my favorite places, LA. And then Olivier Bernier, who is an award-winning director of Forget Me Not, a documentary in which he and his partner Hilda share their personal story around finding supports for their son in New York City's segregated education system. And last but not least, we have Amanda Schwiening, who is a working mom with an energetic 20-month-old that also has Down syndrome. And she has been, I love this one, married to her best friend for 7 years now, a la Valentine's Day. So welcome, everyone. Thank you for joining us today. We're really excited to have this conversation. And so along the same lines, Chloe, do you want to say a little bit more about yourself before we delve in?
Yeah, sure. Thank you, Erin. Thanks for the intro. I am a COOP leader at Cooper, finishing up a doctorate in education, and have a lot of practical experience in the classroom in early childhood settings, but also speaking from the perspective of a student and teacher who grew up with learning disabilities. So I'm excited to get into a conversation with everyone.
Thanks, Chloe. Allie?
Hi, everyone. I'm Allie. I'm a pediatric occupational therapist. I'm the founder of a company called Play to Progress and the author of a book also called Play to Progress, Lead Your Child to Success Using the Power of Sensory Play. My work is really all focused on the sensory system, specifically sensory integration. And my goal is, how do we bring the concept of sensory integration in mainstream to help all kids and build a strong foundation.
Thank you. Olivier.
Hi, everyone. I'm Olivier Bernier. I directed the feature-length documentary Forget Me Not, which follows our journey to get our son Emilio included in general education at the age of 3.
Great, thank you. And Amanda.
Hi, I'm Amanda, and I have a son. His name is Colt. He has Down syndrome. He's our only child. And I'm basically just like a working mom that's just trying to figure out parenthood, along with the medical complexities that come with Colt's diagnosis, and just kind of our journey we've had with him.
Great. Well, welcome, everyone. Thanks for joining us. So I think, there's so many topics that we want to cover, but in sort of a short amount of time. So in thinking really about, we talk so much, the common phrase, right? It takes a village to raise a child. And, I think there's a lot of truth to that, but sometimes it can be hard to find that village, especially, in my experience working with parents, if you have a child with a neurodiverse need or a medical condition. So I think, it would be really helpful to hear both from Amanda and Olivier around their experiences as a parent, finding their, community of support for themselves and their child, and then from Chloe and Amanda around, sort of from the education and occupational therapist lens of how to support parents as they do that. So sort of opening it up to Olivier and Amanda, what were your experiences like? And do you have any sort of advice for other parents?
I could get started. It takes so many people to kind of guide you through the process, and there's so much learning, and you wish you could just type in Google, in our case, like, how do I get my son included in general education? But it's really more complex. I had the really fortunate experience where I got a grant to make a film about inclusive education, and really we're making a cerebral film about what inclusive education is and trying to discover it. But as we were making that film, our son was being pushed towards a segregated setting, so we started to turn the cameras on our own story. And it's really, if it wasn't for me being completely immersed in the subject matter for 2 years, I don't know that I would have gotten through it. And by the way, my wife is a special education teacher in New York City. It was still difficult. So, I don't know that there's any easy answer, but what I do go back and think on a lot is, the people of different income levels that might not have the time or have the resources to do what we were able to do, to fight for inclusion for Emilio. So, I think that it's really challenging, but there are a lot of resources out there, and, I'm sure we'll talk more about that throughout the night.
Thank you. And Amanda, what was your experience? Like, I know it's also different school systems, different environments, right?
Yeah. And so, I mean, we're not really, Colt's not 2 yet. But my plan is to put him, we do have a special education program in our school system that kids with special needs and, neurotypical kids are together. And it's kind of like a pre-K that starts at year 3 up until they go into kindergarten. But I know that there's many school systems that don't have that option. So I am thankful we have that. And then just to kind of touch base, it absolutely takes a village there. In Colt's early days, he was born 26 weeks early. So we had a whole nother like premature side that came with health complications and put, a bigger responsibility on us. And so Colt's had a huge care plan team down to therapists, physicians. We have different people we see, pretty regularly, including, physical therapy, occupational therapy, speech therapy, and then also everyone in his care plan team. And then also people that just to support us as we're getting through everything. Just having that support system when you've had a hard day of advocating for your child. And, I always tell people it's sometimes, I would never change it and I will always do it for him. But sometimes when you're fighting for things that, every kid gets and he doesn't because he's different. And so that can be exhausting. So having that just support system for yourself, just to kind of unwind on when, you've had a hard day is, really important to me.
Can you talk a little bit about how you found that support system? Like, was it online? Like, how did you sort of get that group around you?
Honestly, it was Instagram. I mean, when Colt first was diagnosed with Down syndrome, I honestly went to just searching Instagram, honestly by hashtags, hashtag Down syndrome, and just was pulling up tons of moms that were experiencing similar things. And so I kind of plugged into a couple of groups, just basically Instagram pages that just post about advocating for kids with Down syndrome. And so it connected me to a lot of moms that face similar things that we do. And what I love so much about the group that I'm in is really just there's moms in there that have kids that are young, that have kids in elementary school, middle school, and even adult children, that maybe they live out on their own and they're navigating that, or they still live with their parents. And so I think it's really nice to be part of that group because we get so many different perspectives. And then also I always encourage people, if they're coming into a new diagnosis is, looking for your local group. We also have a local group here that we meet quarterly. Sometimes we have different events and things, but just being able to physically touch someone that's also going through a similar journey. And that was really just kind of Googling. I did not get a lot of support from my physicians or saying, hey, I know you're dealing with this diagnosis. Here's some resources. And so we are working on trying to help just that process of having physicians say, hey, here's some resources for you when you're ready.
That's good. Allie, have you, because I'm sure you deal with the medical community a lot, sort of, have you found a way to support parents more around finding resources and through their physicians?
Yeah, this is a really good question. And Amanda, something you said is something I often think about, which is, you're right, we need a more centralized way to get parents the resources. I'm lucky in that I'm connected with a big community of resources. And I find a big piece of my job is connecting parents to all of the additional resources, but they first have to be connected to me. So that in itself is a big challenge of how do they get to me? But even once they're to me, I do find it that, you know, I really take on that responsibility of making sure I'm providing as many resources that we can to help support the family in all areas, whether it's therapists, you know, parenting groups, other specialists, anything else that, you know, the family needs.
And Chloe, from an education perspective, what have been your experiences in this?
Yeah, so I mean, keeping the communication alive between all the different resources that everyone's spoken to, right? Because the support team for a child with a disability can be really extensive. So in the classroom, just making sure as the teacher that I'm staying on top of it and communicating with the team. And the team includes the parents, absolutely, but also other providers who are involved, right? So making sure that there's some consistency across different settings as well. So Allie, you know, if I had a student that was working with you, I would be in touch with you, right? Like we'd communicate about what you're doing in your practice and what I could bring into the classroom in my practice.
And just to piggyback off of that, I think that is actually one of the most important things. We are really big on that at Play to Progress, open communication. And if you do not have it, I think you're actually limiting the progress that a child can make. And similarly, you know, we are often helping parents know their rights. And that sounds silly, but navigating IEPs, all the different therapies, what they can get from the state, what they can't, that is something that's really, really hard. And we will sometimes be there, you know, the first person they're seeing. And then we're saying, okay, we need to initiate, like we suggest you going to the school district, initiating an IEP, but when they do that, they don't know their rights. And there isn't anyone there telling them their rights.
Olivia, can you speak a little bit towards that? Because I know your documentary, features sort of this process that you went through as well around figuring out what your rights are as a parent for your child, sort of navigating that system and what your experience was with that.
Sure. And I'm sure Amanda can relate to this, is that when your child's born, you want the same thing for your child that you'd want for any other child. And just because they have a disability, that's no different. So, the very core basic human rights are expected, I guess, but they're often ignored. And I think that navigating how to make sure that those rights are given to your child is challenging. And it's something, we go over it in the film, or you see us go through it, and it's just shocking that, you have to fight for your child's right to be in a classroom, even though the law says they can be, and it's as many resources as possible is helpful, but it can also be overwhelming in some regards, because you only have so much time to read. You can only hear so many stories about how people did it. At the end of the day, you end up in an IEP meeting with someone that disagrees with you because your child's data shows that they shouldn't be in a general educational classroom. So I think, to make a long story short, it's it's a challenge, but the more information you can have going into those meetings, the better. And ultimately, there's going to be a lot of disagreements with people you meet along the way, how your child should achieve that success. But I think the most important thing that you can do is remember that, you're there to collaborate and work together, even if they don't listen to you sometimes. It's still really important to try to find some common ground.
Has that been your experience, Amanda, as well? So that idea of sort of finding that common ground when you're navigating all this?
Yeah, definitely. I can, speak a little more to it, in like the medical field. Colt has had extensive hospital stays, when he was in the NICU and then when he had open heart surgery. And I would find myself trying to, fight for other tests or fight for a second opinion. And it would always be dismissed, well, he has Down syndrome. That's just part of, things that he does or he has. And that's not an answer that I'm going to accept, just because, we know our children the best. And, when I know when something isn't right or something, just he's not acting right or himself. And so I've definitely seen that a lot in the medical field. And like I said, I can't speak a ton on it in education, but I do know, like I've already started some research and we're, a little bit of ways from IEPs and things, but I've definitely already started talking to other parents and doing some research about what our school district has and those kind of things, because I do want to be prepared. And I want to be able to have the knowledge I need to make sure he does get, like, Olivia said, his, basic human rights. And, I hope that it's not a time where I'm having to fight so much for it and that he does, get those things, but I will be prepared for that if I do have to.
So I'm just thinking, Allie, sort of two questions for you out of what we've been talking about. One is, how do people get to you? Like you were saying, often you're the first, sort of stop for folks. And then two, what are your recommendations for sort of navigating the medical part of all of this?
Yeah, good question. So how people get to me, specifically what I specialize in is sensory. And there's a few different ways that people get to us. One is through their pediatrician, and we are lucky here in LA to have some champion pediatricians who, really believe in OT and refer to us. I think there's a lot more education that needs to be done to pediatricians around sensory and the scope that we work with. But we're very lucky here to have some that, send kids our ways. The schools, so the private schools, they send a lot of kids our way. So private preschools and then also private elementary schools, which, they'll refer kids our ways, word of mouth. And then we actually run a variety of different Parent in Me classes. And in these Parent in Me classes, we talk about development and different things. And occasionally we will get kids come that way as well. So different ways that people hear about us. I think that there needs to be a lot more education on what sensory is. Often someone's getting referred to us, or they're in this state of just desperation. And someone says, call Allie. And they call, but they have no clue what we work on. And then it's on us to educate and make sure they truly understand the sensory system. Because my personal belief is you cannot make progress without partnering with the family. If the parents do not understand what's going on with their, within the sensory system, then we're stopping progress right there, because where do they spend most of their time is at home, right? Or at school. So teachers and families really have to understand what the sensory system is and what is going on. I think, when it comes to the medical system in sensory specific, I won't lie that this is an area that I also struggle with, because I feel like I'm often, educating on this is what the sensory system is, and kind of, screaming it at the top of my lungs that it's not a behavior, it's sensory. It's rooted in sensory. And so it's a lot of advocating. I think for me, I never stop advocating. I won't stop advocating for any child that we see. I tell parents to advocate. I always tell parents what your gut is saying is right. No one knows their child like a parent. If you have a gut, there's something more, follow it, And so I partner with parents. I rely on them, and I help to guide them to advocate in their medical communities. And then I also, around LA and anywhere I can, try to educate as much as possible on sensory and what that might look like and why that's different than a behavior and why we need to change that framing from behavior to sensory, because that really changes our, I hate to say this, but like our judgment on the child from, you know, thinking this is a quote unquote bad kid. I don't believe any kids are bad kids, to actually seeing what's the root. Why are they doing what they're doing? Because there is not a bad child.
You know, I really like that distinction that you make between sensory and behavioral. Can you talk just a little bit more about that, and then sort of how it could relate to Downs and other, you know, neurodiverse conditions?
Of course. So when it comes to sensory versus behavior, I'm going to give just a really easy example. If a little one sees that their little brother has a lollipop and they want the lollipop and they think to themselves, how am I going to get that lollipop? I'm going to walk over and rip it out of their hand. That's a behavior, right? They're consciously choosing, I want the lollipop my little brother has, so I'm going to rip it out of his hand. Also very typical. It happens. Sibling rivalry, normal. What is more sensory? If a little one is in a preschool class and it's loud and there's a lot going on and they are feeling overstimulated and they see a friend and they bite them, it's very impulsive. They just go and they bite. And I'm using bite because bite is one of our sensory, you know, reactions that gets the biggest school reaction. It's the biggest deal, right? And I understand why. Well, that child, that bite might be providing proprioceptive input to the child, which is then helping to calm their nervous system. They're in a state that is overstimulated. They never said, let me choose to bite. That was very impulsive, very innate, based on a body need of them when they were, that they had when they were in a dysregulated state. The two are completely different. I chose to grab that lollipop. I did not choose to bite. But if we say to the child, no biting, you know, we treat it like a behavior. Well, all we did in that moment was shame that child when we still are not fulfilling their sensory need. If we shift that from, I see your body was feeling really busy. Your body, we love the zones of regulation. Your body was feeling really in the yellow zone and you needed some, what we call a body tool. So you really needed a body tool. It may have felt good on your body to bite Johnny, but I noticed it hurt Johnny's body. I wonder if we can use a chew tube. And now we're providing something else. We're saying, I see your body. I see what you need. I see that you bit Johnny because of that need, not because you're a quote unquote bad kid or any of that. I'm not shaming. I'm not doing any of that, but instead I'm providing awareness of what's going on in their body and how to better fulfill that need. And so that's the shift. And one is very shaming. If you notice, I said your body, I never said you bit, because it was not their choice. It was out of a body need. So also being very, very mindful of language is very, very important. When it comes to talking about the neurodiverse population, sensory processing disorder is of course included in that, but we know that there is many times more than one diagnosis. So we know that autism and sensory processing go together, ADHD, sensory processing. So there's many diagnoses that fit into this bubble with sensory processing. There can be more than one. And so it's something we look at. We, as sensory specialists, definitely look at the full picture and use a sensory perspective to treat. My belief, the sensory system is extremely powerful. We need in the medical community more sensory inclusive environments in a hospital. We need more sensory inclusive environments, something we don't talk about. But if a child is going through cancer treatment, we've seen this, and they're spending these formative years of their life in isolation. Well, during those formative years of your life, you learn through the sensory system. They're thereby now we're eliminating a lot of sensory input from their life. and we're not giving them the opportunity to build these neural connections. So then when they are, thankfully through treatment and now expected to go back into a classroom, well, that's a lot. So we also don't think about sensory within a medical environment and how we need to adapt and shift it, not just for our neurodiverse kiddos, but actually for all kiddos.
Thank you. That was such a good description, and another assembly topic, but I think it's so important because I feel like also in psychology, we often tend to sort of ignore the sensory part of things, and it's so important. So thank you for bringing that up. I just wanted to also, there was a question in our chat for all of you, but particular Allie, thinking about preschool and pre-K expulsion. So she says, I feel like my child's school is always looking for a reason to kick us out, even though we're working with OTs and tutors. Any advice? So Allie,
Don't
all
get
of
me
you.
started on this one. We have this problem in LA as well. And I know where I'm from in Michigan, they also have this problem. So my guess is it's nationwide. I think it's a massive issue. I think, we're talking about inclusion here. We're talking about this. We are not creating inclusive environments for our kiddos. And that's a really big problem. They're, like I said, and I feel like I'm, saying it over and over, but a preschooler cannot be a bad kid. That's not possible. And so what we're doing is we're saying, I can't help you. I'm just going to kick you out. And just saying it's you. It's not, let's change our systems to recognize that we're not a system that can, adapt to a neurodiverse population. Let's just get rid of that. And that to me is just beyond horrible. I think, there are some really great schools. I train a lot of schools and really train on this is how we create a sensory inclusive classroom. This is what we need in our classrooms. Every classroom should have a cozy corner that is just silent, small, tight, a place where if a child is feeling overstimulated, they can go. But sometimes just to get a cozy corner, to get that simple accommodation in a classroom, I'm pushed up against. And I won't lie, there's times where I'll say to parents, like, enough, just leave the school because they're not going to make the accommodations. But it shouldn't have to be that way. And so for me, the number one way to get around it is education. And so I really try not to go into preschools, not attacking them, but instead, like, let me teach you about the sensory system. I train preschools often for free because I want them to understand this is how you adapt a classroom, because where it really comes from is a lack of understanding. They don't know how to deal with it. And so it's too much for them. If we can make that feel more manageable, that's where, it's so important that OTs are partnering with teachers. We should all be communicating. If we're not communicating, we're sitting in silos. So if you're working with an OT, the OT has to be communicating with the school and explaining what's going on and how to accommodate in the classroom. And then the school has to be willing to meet you there.
So Olivier, has that been sort of your experience with navigating the system for Emilio from pre-K, right, kind of forward? Would you say that part of your experience was like that there was, if we don't have all the resources here, we're just gonna kind of send you someplace else?
Yeah, that's been our experience to a T. And it's interesting now because we feel like we found a really good place for Emilio. So we've seen kind of both ends of the spectrum, I believe. And, his first setting, we kind of got pushed into a school because it was the only one they would let us go to, essentially, in all of New York City. And I don't think it was the right school for him. They didn't really believe in inclusion practices, and it was very loud sensory wise. It was very difficult place, and there was a little bit of a struggle there. And now we're learning in his current school, they give him breaks, they give him the ability to kind of step back and to, recalibrate, so to speak. And, he needs a little bit of alone time sometimes, and that's been really helpful. And they've slowly been building up his attention, so, it was like 1-2 minutes at the beginning of the year, and now he's going 5 minutes, 10 minutes, or however long it is now. So they've really been working with Emilio, not just what they think Emilio should be doing, but actually looking at our son and trying to figure out what works best for him, and having that as a base point. So I think it's been clear to me what's successful and what's not. And then, I think too, when we were filming and we went to the Henderson School up in Boston, which they do a lot to accommodate different children of all different types of needs, and I think in their preschool area, they lowered the ceiling of one of the classrooms because students with autism were having a hard time with the echo in the classrooms. And they actually lowered the ceiling and dampened the sound in the classroom so that they had one room that was less echoey. And they found a lot of success. And it's just, I think, if you look at the educational system, that's really what it is. Whether you're neurotypical or you have a disability, it's problem solving. I had challenges when I went to school and my teachers problem solved them. And I think that the most successful classrooms you see are ones where the teachers are collaborating and trying to figure out each student and working together to come to a good scenario for that student.
So true. I think, at least my experience so far with 2 children has been also, though, finding those schools, right? That it's, it takes the resources, it takes the time, it takes to find an environment that's, going to look at your individual child, not sort of, developmental milestones or whatever. So I'm curious, Amanda, like you're starting sort of this process, right, of the whole school, the whole school thing, sort of what your, kind of thoughts are as you dip your toe into it with the pre-K experience.
I mean, I would love, right now Colt stays at home like with me, and we have like a nanny that keeps him, because there's no daycare or program that he can attend right now that can accommodate like his medical needs, which I mean, is a whole different thing to kind of discuss, but it's hard because he's missing out on, playing with other kids and getting that social interaction even at a young age. And it's just because we have no options here. And then, once he turns 3 and he can go into pre-K, we'll kind of slowly, the good thing is we can kind of choose. So we'll probably start like, 1 half day or maybe, 2 hours, 2 days a week or something like that, just to kind of get him, because it's going to be a little shock to him, right? Because he has not had all of this exposure. We do play dates and things like that, but that's different than being in daycare with other kids and playing with other kids and eating with other kids and all those kind of things all day long. And so I do worry about that. It is something that I wish we had more resources here for. And I wish that there was other options where he could get that, play time and that social interaction that he needs as he's, developing and those kind of things. But I do hope, I have high hopes for what it'll look like when he gets into the pre-K system. The good thing is I do have, I was born and raised here. And so I do know a lot of teachers in the school system. One of my very, very good friends is a teacher, and so that's helped me kind of learn, there are some teachers that just aren't willing to, be the team player and work with therapists and work with parents. So being able to hopefully have the teachers that will help us, have collaboration to, help Colt be successful.
One tip I just wanted to jump in on that really helps me navigate all of this is when I'm approaching teachers, and I tell parents this all the time, I'll often say, let's try this, but it doesn't have to just be for, this child that I'm working with, because it's actually a benefit to the entire classroom. Most of the time, it does benefit the full classroom. And so if I'm asking for, a certain seat or something, I'll say to the parents, like, maybe buy 4 of them if they're able to, and put them in the classroom. And then it's not just for that child that I'm working with. And I sometimes find that will help teachers meet me there a little bit more and help parents also get the teachers to kind of meet us there in the classroom, ultimately benefits the full classroom.
To go off a little bit, Allie, of what you're saying, speaking from the education perspective in the classroom, one of the things that I always did in my class was just have an understanding of sensory preferences within the classroom setting, whether you are neurotypical or neurodivergent. And so providing options, Allie, I love what you said about like, if parents are able to buying 4 of a squishy seat, for example, right? But creating a space where, Olivier, like you said, like you're problem solving for all kids, though. This is not just for neurodivergent kids, right? Every student, we need to look at the whole child and what works for them. And so creating, and even at home, right? Like understanding what their sensory preferences are, right? Because there are some huge differences between home and school, of course, like the noise level being one, the amount of transitions being another. But those conversations can still happen, right? Neurodivergent or neurotypical.
One thing I'll say, a story about myself, I was during COVID, like looking at old paperwork in 2nd grade. I wrote that I needed to work on being fidgety. I was too fidgety. So if I wrote that I need to work on that, that means I was having shame for that. The reality is what my body needs is I need a body tool, right? I need a fidget. We call them body tools because it helps to bring more awareness. And what if that shift was made for me in 2nd grade? Not that you're too fidgety, Allie, you need to sit still, but oh, your body needs a body tool to help you pay attention. Think of those 2 differences. That's every child in the classroom. Right. So while we're talking about, it's so much more than just a neurodiverse child. It's every single child learns differently. And we need to stop trying to shove them all to learn the same way.
And I think that's a great point, creating an inclusive classroom where these conversations, obviously it's easier to do with a 1st or 2nd grader than a preschooler, but asking questions like, how do you learn best? And giving examples, even as parents, as teachers, sharing how we learn best. I would always say, I learn so much better when I can see a picture to go with the story, right? And it's really the beginning of advocacy for our kids, right? And this is something that we can model. I mean, obviously in the classroom, in the OT setting, but also at home. Like, this is how I learn best.
Definitely. And I think something that Allie's been speaking a lot towards, but everyone, is this idea of language too, and how we, it's not you bit somebody, it's your body needed this, and this is, sort of, and I think, we're becoming more aware as a community around language and the impact of language on identity and on treatment. So I'd just be curious to hear sort of each of your perspectives on the language that's being used right now, whether it be, is it neurodivergent? Is it, learning differences, and sort of thinking about the language that you want, in cases of Olivier and Amanda, your children to, identify with as they mature.
I can jump in. I think, language is a tricky one because not having much exposure to people with disabilities before my son was born, I suddenly got thrown into this world where it's intimidating of saying the wrong thing all the time. So that's the first thing, is that it is challenging for a parent. And then I think of someone who doesn't have any involvement of people with disabilities, it could be really challenging trying to always say the right thing. But, I will say that there's some examples that have stuck with me since Emilio's born, because obviously that's changed my whole perspective. Is that, for example, in schools in New York City, they say integrated settings versus inclusive settings. And to me, that's like a huge just difference in mindset. One is like, we're allowing your kid to join the classroom, as opposed to inclusive, which is like, this classroom was built for everybody. So that's like one of the distinctions that I think about often. But I think as a parent of someone with a disability, I find it really important to be patient with other people that might not know exactly the right way to approach a conversation or to ask something. There's still some people from, older generations that might refer to Emilio's condition as something that could sound offensive at times. But it's important to be patient and just understand like that there hasn't been much exposure to this, and that conversation will kind of change over time, as the generations are more aware growing up. But it definitely in a professional setting, I'd say that as the more inclusive language could be, the better. The more it invites people to conversation, the better. And just talking about, one thing that I think about often is that, especially in New York, Emilio's deficits were often the point of the conversation, as opposed to what he's really good at or what he excels at. And I think, that's a big mistake, is to focus on a child's deficits. So I hope that, going forward, we have different experiences where people focus on what Emilio can do and try to push him in that direction.
Thank you.
Yeah, I would definitely agree. Like I said, I still feel like, new to this journey. But I have also learned to just have grace with people because, before I had Colt, I didn't have a lot of experience with people with disabilities. And so I think just, being very like polite when you're correcting someone if they say something incorrectly, and really just trying to show people that you're just trying to educate them and not shame them into what they said, I think is important. And I think a lot of time, especially around people with Down syndrome, it's definitely like people first language, they're a person first in a diagnosis. And so just kind of, teaching people that Colt is a kid with Down syndrome. He's not, a Down syndrome kid, those kind of things are important. And, a lot of people, even in the field, may not know that. And I think just like, being nice about it and always just trying to educate and not shame is important. Because I wouldn't want someone to say, like, you said that incorrectly and be offended, other than just saying, hey, this is kind of what we say instead. So I think that that's, important. And definitely, we go through Colt's in early intervention. I'm sure you guys are familiar with that. It's in all states. And so we have meetings where we talk about, what milestones typically developing kids should have. And a lot of times, like what Olivier said, is just, well, Colt's not doing this and this and this, and he should be doing this and this and this. And I'm like, yeah, but look what he is doing. He's been through a lot. He's had open heart surgery. He's done all these things. And he may be behind like his typically developing peers, but he is doing a lot of great things. And sometimes that can be very disappointing and discouraging to a parent, because you've seen what they've done and how hard they've worked to get where they are. And so sometimes just highlighting those things that they are doing, even though I know you do have to talk about, this is what we need to progress on and this is what we need to work on, but being careful about the language you use around that, I think, is important.
Yes. And Allie, what would you say from your sort of professional lens?
I think language is extremely important, and, understanding, of course, how we address. And then there's another piece of language that I think sometimes is not talked about in this discussion, but it's how do we talk to a child about their body and what's going on? How do we introduce different, accommodations that they need? You heard me say body tools, not fidgets. I think fidgets can be sounding like a toy and maybe a little bit demeaning, whereas a body tool is recognizing how important that is for that person to learn. That's a body tool. Your body needs that. And, I'm really big, especially in the sensory world, to say your body, not you. You did not choose to do that. Your body did that. And so being really mindful of language as we talk about kids. And one thing I often say is a child is also a person. So they also deserve respect. And so if we're going to do something to them, like, Amanda, I'm sure you've experienced this in the medical world, we need to tell them. We can't just go in and pick them up or give them a shot, or, if a child or a person is in a wheelchair, you don't just touch their wheelchair and move them. You ask them, and so You ask, do you need any help? If they need help, they might not. Their preference may be, I move myself. And so all of these things are really, really important. And it's important to teach a child to start advocating for themselves and their body. We have little ones who are, you know, so great. They're in preschool and they'll come up to me and say in our OT groups, I need a body tool, or my body needs a break right now. I need a body break. They have learned to recognize what they need, but that all comes from language in teaching that. And so being extremely mindful of the language. We rarely use the word no, and that doesn't mean we don't set boundaries, because we do, but it's how we're using it is very, very mindful.
Great examples. So Chloe, in terms of, you know, the educational world, what are your thoughts?
Yeah, so similar to Allie, I mean, the language piece is huge, but also understanding this in regards to all kids. So knowing what you need, and at the early age in a preschool classroom, this starts with offering choices to kids. So we often see some type of choice time, right? And as kids get older, this might evolve. In a math lesson, I might give 3 options, you know, go where you think you'll do your best learning. And so maybe there is a visual component, maybe there is a movement component to math, maybe there is a sensory component. And so as the teacher, I take it as my responsibility to offer choices, but also to model language around what choice I make. So I might make a choice today that's different from what I make tomorrow, right? And having this flexibility in understanding that some days one thing might work better for me than another. And what works for me doesn't necessarily work for the person next to me. And so having an open line of communication, and literally this looks like modeling it in the classroom. Like I might call a student up and I might say, you know, this is how I learn best. I know that I really like to move. My body wants to move. So I think I'm going to choose hopscotch as the option for learning addition today, right? And continuing to model that across all areas.
I like that idea of, I don't know, something I'm sort of hearing across is like agency, that sometimes I think with young children in general, and then even more so with children who are experiencing medical conditions or neurodiversity, it's like taking that agency away from them often happens, at least I've seen that, but allowing that agency and respecting that agency is so important, right?
Yeah, and what typically happens in a classroom, we often see this traditional classroom setting where it's a desk and a chair for all of our students. And as an educator, right, and we need to remember that not all students learn that way, right? Our students are capable of learning, but students need different things to succeed. And a lot of that falls on the teacher providing choice, right? I used to say, if you need to stand up, if you need to do squats during a lesson, that's fine. If your body needs that and you're not disturbing, meaning you're not hurting other people in the classroom, do what you need. That's early advocacy.
Great example. So I'm aware of time, and I want to sort of end with where folks can find you all for more resources around this, but just, you know, I'm trying to model what I see on like CNN and what seems to work with people when I facilitate things. So quickly going around the Zoom room, one piece of advice you would give to parents who are looking for their community who have a child with a medical condition or a neurodiverse. So Olivier, I'm going to start with you since you're now in my circle, the first in my circle.
Look at me. So I think as far as finding your community, you know, I think there's so much out there, and thank God for the internet. We're actually like really fortunate, Amanda and I, as parents right now, that we get all these resources kind of at our fingertips and can connect to so many people. You know, I think the most important thing to do is to know what you want for your child, and then to take that and turn it into an action plan. So I think, you know, those are conversations that are deeply personal, but once you figure that out, I think that'll set you on the path to finding what you need for your child.
Thank you. Amanda.
Yeah, I mean, I would absolutely agree. And I think for parents that are just starting the journey, is there's a lot of steps to it, right? You definitely have to take some time to process the diagnosis you've been given for your child. And, you know, when you're ready, because you're not, you know, when I birthed Colt, you know, I'm not ready to like join a mom group, and I'm not, you know, at that point, I need some time to just process the diagnosis and how those changes are going to be for our family. And then starting to find resources. And I think, you know, like you said, the internet does a great job of getting involved as much as you want, right? So sometimes it may be that you don't want to be doing events and involved in all these things, but you do want to know about the education piece, and you do want to make sure your child gets what they're supposed to have. So I think just, you know, making sure that you are getting plugged in to the extent you want to get plugged in, and having that support system, even if that means, you know, family members or friends or things like that. I mean, just speaking from our experience, your life definitely changes in a lot of great ways. I'm definitely part of, you know, mom groups and friends with people I never would have been friends with if I didn't have Colt. So it's opened up our lives to some wonderful things and some wonderful people. So just making sure to get that, you know, plugged in time with the people that, you know, can encourage you and help you get through anything you're going through with your child.
Thank you. Allie.
I think I'll kind of repeat something I said earlier, which is trust your gut as a parent. Your gut is correct. And then don't stop. It's going to come out screaming at the top of your lungs. But what I mean by that is never stop advocating. Don't let anyone convince you, you know, your gut is wrong. Continue to advocate and advocate and advocate, and push your team harder. Push them to connect you with more resources. Ask parents, do whatever you have to do until you feel settled in that your child is in the right place, both within their team, everything, you know.
I love that idea of going with your gut. I feel like sometimes as a parent, you know, because you have the professional life and your parental life, right? That often, you know, sort of going with your gut I haven't felt as accepted sometimes when I say that, right? And like, you know, a meeting like, this is what my child needs, I just know it, versus like, oh, I'm a psychologist and this is what my child needs. But so important to just stick with your gut and have the confidence to do that. So thank you.
Yeah.
Yeah, I think Amanda and Olivier said something so important, which I really respect, having patience for people who are continuing to learn about whatever specific disability your child has. And so I think as a parent, that patience, I think it can be very challenging, but it's also really important because from the teacher side, teachers need to understand that even if children share a diagnosis, their experience is not the same. The accommodations they need is not the same. And as a parent, you know your child best. So bringing those conversations to your teacher, who may have a special education degree and may understand Down syndrome broadly, but doesn't know your specific child and their needs. And the best way they're going to know your child's needs is by hearing them from you. And as your child's needs evolve and as they grow, continuing that conversation. This is not a one and done, as I know you guys know from your experience. It's an ongoing process. So the communication is just number one.
Well, thank you, everyone. I think that's such a great way to sort of wrap things up, the importance of communication and, you know, believing in ourselves as parents as well, right? And what our children need. But I do want to, you know, let people know where Olivier, Amanda, Allie, where everyone can find you. So Olivier, do you want to say sort of the best place where people can reach you if they want to hear more?
Sure. Well, the film is called Forget Me Not, Inclusion in the Classroom. There's a lot of Forget Me Not films out there, and you can find us on the internet at forgetmenotdocumentary.com. And there's a bunch of resources that I found useful as we were going through the journey there. And yeah, you know, the film right now is streaming on Amazon. It's on Tubi. You could see it for free with a little bit of advertisement. And I just hope that people get to see the film and share it, and hopefully it impacts some conversations down the road.
Great. Thank you, Amanda.
I mean, I'm on Facebook and Instagram. I think hopefully you guys will share like our handles or something afterwards. But yeah, I'm like an open door. I love connecting with families. Even, I mean, I have connected with families that have kids with different disabilities, but we're still kind of in the same world. So yeah, you can find me there, and I would love to connect with other people.
Great. Thanks, Amanda. Allie?
You can find me at play2progress.com. You can also buy my book anywhere that books are sold. It's Play TO Progress. So the company is the number, the book is 2. And then, you can follow us on Instagram at Play to Progress. I'm at Dr. Allie Ticktin. And then also, if any of you guys have schools that you're feeling like they really need sensory education, like I said, I do a lot of free training at different schools, guest lecturing and different things, because my goal really is, how do we teach educators and teach other professionals about what sensory truly is?
Thank you. And Chloe, where can they find us?
Everyone else can find us at Cooper. I am a group leader at Cooper and would love to see you in a group or at a future assembly.
Great. Well, thank you, everyone. I'm Erin at yourcooper.com if you ever feel like emailing me for any reason. And it's been lovely to have you all. Thank you so much for joining us. And thank you for all that joined today as well. Have a good rest
Thanks
of
for having me.
Valentine's Day. Bye. Thank you.